Welcome everybody. I'd just like to say a few words about our esteemed team of panelists. I'm going to introduce them individually, one by one. You can see them all on the screen at the same time. We have Chris Barker, who's a CEO and founder, and as he describes himself, chief mischief maker at Spirit Healthcare. Chris is going to be talking about his virtual ward care solution called CliniTouch V. We also have in the room with us Leon Eisen. After Chris is talking, Leon, who is CEO and founder of a company called Oxitone, his specialist area is the use of wearable technologies to provide continuous care. So he'll be a natural follow-on from Chris Barker. So the first half of the presentation is really to do with continuous care and prevention of some of the impacts of ill health. From there, we're going to move on to Joao Bocas, who's the wearables expert. He's done some research into wearable technologies, in particular in the context of preventative healthcare. And he's going to be talking about his experience, the work that he's done, and giving us a view of the future. And finally, we're going to finish up, last but not least, with Professor Ron O'Donnell, who's kindly joined us from Boston in the USA. And we're all very impressed by the fact that he's wearing a suit, even though it's about 6 o'clock or 6:30 in the morning where he is. So thank you very much for getting up early to join us, Ron. So now what I want to do is to just share a couple of slides with you and get some feedback from you on a number of different important questions about preventative healthcare. So I've created this matrix really to look at different ways in which you can invest in preventative healthcare. And I've created this grid where on the top axis it's split between communicable diseases like pandemics and non-communicable diseases such as lifestyle-related conditions such as cancer, cardiovascular disease, diabetes, obesity. So we can invest money in the prevention of these communicable diseases and also non-communicable diseases. But also preventative healthcare is also about reducing the impact and the cost of communicable diseases and non-communicable diseases. So we're talking here more about treatment and management of conditions. So in the bottom left grid, you've got things like colds and minor conditions, where the main focus of preventative healthcare is to prevent hospitalization and prevent loss of income, inability to work, etc. And on the right-hand side, we've got the kind of conditions like cystic fibrosis, a number of genetic conditions which are non-communicable, but still have an impact on healthcare and healthcare costs. So at this point, I want to bring up a poll now, and I want to invite the audience to be able to give their opinion on what the main priorities for preventive healthcare should be. So I'm going to launch the polling now. So we've got about 70% of you have voted at the moment. So I'm going to end the polling and I'm going to share the results with you. So we can see that the slight majority of them, slight majority of you are in favor of investing in the treatment and management of non-communicable disease to reduce their impact and cost. But we still have significant numbers of you who say that we should invest in the prevention of pandemics and non-communicable diseases. So I'm going to stop sharing those results and I'm going to move on to the next slide. And the next slide really looks at who the healthcare stakeholders are. Now, ill health, whether it's a communicable disease or non-communicable disease, has an impact on all of these people. It has an impact on the individual, whatever age they are. It has an impact on their family. It also impacts doctors and clinicians who are required to treat them. It has an impact on hospitals who need to organise themselves to deliver the care. It also has an impact on employers, insurers, and of course, as we know only too well, it has an impact on government and public health policymakers. So the next question I want to ask you within the poll is about the responsibility for payment. And so now, as I launch the polling, you're being asked to say which of these healthcare stakeholders should bear the majority of costs of digital preventative healthcare. Now, it's a multiple choice option, so you can choose more than one option if you wish, but I'm more interested in who should bear the bulk of the cost. And this will give me a kind of steer on the sorts of questions that we can discuss when it comes to the end of the polling questions. And you can see, perhaps not surprisingly, that 84%, the majority, feel that individual government should bear the bulk of the costs, but also a significant number of you say that the insurers and citizens and patients should bear the cost. It's interesting that we have low figures for clinicians, hospitals, and employers. So thank you very much for your answers. I'm now going on to the final question, which is to do with the primary target users of digital healthcare. So who should we target when we're developing digital applications for digital healthcare? Again, it's multiple choice, so you can select more than one option. So where should the primary target be? Should it be citizens and patients? Should it be clinicians, family, hospitals? Should it be the government? Should it be employers? Who are these users? And bear in mind, when we're talking about applications, you also have to take into account things like privacy, data protection, but again, you've got to balance these against the collective responsibility for healthcare. So, yeah, that's very interesting. I'm going to end polling now, and thank you very much for all of your answers. And once again, I'm going to share the results with you. So we can see, by and large, you think that it should be the individual citizen should be the primary target users of digital healthcare, rather than clinicians, hospitals, insurance companies, government, etc. So thank you very much for those answers. I'm going to stop sharing now, but we will come back to revisit these questions right at the end of the presentation. And right at the end of the session, what I'm going to do is, as you log off from the webinar, the workshop, you will be directed to a survey, which again asks you the same question, so we can see whether you still think the same after you've heard the presentations from all of our participants. And now, without further ado, I'm going to hand over to our expert panelists, beginning with Chris Barker. Chris, as I mentioned, is CEO and founder of Spirit Healthcare. I'm going to invite Chris to do a 10-minute presentation on what his company does, target users, what the user experience is, and what the benefits are. So, Chris, over to you.
So I think I'd best start off by saying that I'm certainly not an expert in digital health, and hence the cock-up when it comes to even allowing me to present my presentation. What we are experts in as a business is healthcare, and certainly from my perspective, what is the future of digital healthcare? It's how we make it so it's normal healthcare rather than what is currently referred to as digital healthcare. So David, if you can flick on. So I'm Chris. I'm Chief Exec of the Spirit Health Group, of which Spirit Healthcare is one part of it. Most of this presentation talks about one of our products called CliniTouch, which is used largely throughout the National Health Service. And yeah, why is it used? Well, essentially because the same problems before COVID, yet we have an increasingly aging population with complex needs. We have a health service in the UK that largely reacts to illness and treats it. And what we need to do is try and get ahead of that curve and start working with people before they get poorly and before they get more expensive. If they are poorly, we need to be proactive about how we manage that and how we support it. Thank you, David. Who are the stakeholders? Well, so for me, the simple answer is everybody. Health touches on every part of what we do. So be that health providers, digital health providers, the entire health economy, citizens or people, family and carers, clinicians, and indeed employers at the same time. In the UK, governments also come into this because the National Health Service is largely government funded. In different markets that we're having discussions currently, both employers and indeed insurance companies come into that market as well. What are the challenges if we don't do something? So we've been on a journey, particularly in the last few months, where the challenges if we don't engage in digital health are that we are going to have an increasingly complex and expensive healthcare system. With the amount of data that we collect and we can use, we can, in the right way and in a safe and secure, in a way that's comfortable, look to help promote people to manage their own health in a preventative way, but in a way that's also interesting and engaging. And that should move towards the positive outcomes that we see here. So engagement from stakeholders, patients being seen at the right time, improving clinical capacity, as well as all the positive effects on mental health and well-being at the same time. So enough of the preamble. What is it that we do? So we have a piece of software that people can connect to, and in effect, it keeps patients in a virtual ward. So it keeps them in a ward where they can be checked up on by the healthcare professionals, or indeed by family members or carers, as appropriate. It allows us to manage those patients virtually, provide them with some education and some self-management, and also make interventions through video conferences, through messaging, and connecting through to everything from medication to activity trackers. What's the user experience from a patient perspective? Well, so this was co-designed with patients and with citizens and with people with long-term conditions. We are typically looking at patients who have an existing long-term condition, so a diagnosis. At the moment, the emphasis has been largely on respiratory conditions for reasons that I would think are obvious in the current pandemic. But we also work in heart failure and diabetes and increasingly in various forms of muscular atrophy. Patients can go and receive education on a tablet device. They can input clinical signs. That might be something as straightforward as some weighing scales. It might be a pulse oximeter. And we've been working with various stakeholders to engage in lots of different devices that can feed into our software. Our specialism in this regard is integrating the healthcare and the digital together. So it's about getting the right bit of software that clinicians can use. And so for that reason, we're pretty device agnostic. This is the clinician portal that you can see. So it triages patients in the ward into red, amber, and green to keep things as simple as possible. It allows clinicians to set questions specifically for individual patients. And there's various trend analyses that enable you to go and look at the trends for individual patients, or cohorts of patients or groups, whilst also setting care plans. This is largely, from a patient perspective, about informing and educating whilst also supporting them. We also have air quality data included so that people can look at tracking where they are, and if you've got a respiratory condition, you can plan the route that you're taking by the least polluted route. And then there's everything from education on the disease specific, but also health and wellbeing questionnaires that people are enabled to access through the platform. How does it work? Well, from a patient perspective, when it comes to monitoring, they can input data into their tablet or into their own computer or their own phone. It's available as an app and a web app as well. This information goes into the CliniTouch risk engine, which calculates the risk based upon on the results that have been entered by patients, and that goes across to a clinician. If I look at some work in the UK currently, we've been working in what we in the UK call care homes, but are sometimes called aged care facilities in Australia, or residential homes in the US. Yeah, and we're looking at frailty, so tracking people in an aging population and trying to find different ways to flag their status to healthcare professionals. That's enabling us to help support people who are in those facilities to receive medical care proactively without increasing their risk from things like COVID at the same time. So this is a case study. The highlight results. So we've been working with Leicester Partnership Trust for quite a long time, and there's some results from a publication later on in the presentation pre-COVID. These are results during the COVID deployment, where we increased the number of patients about 25-fold in the space of 3 weeks. And this was about people with respiratory disease and also heart failure, and keeping them safe and supported at home, improving their outcomes where possible, but also minimizing face-to-face contact. We reduced home visits by 35% overall, saved the system money, but importantly, had patients commenting that they felt safe, they felt supported, and actually, whilst we can't definitively talk about improved patient outcomes, there was a trend towards improved patient outcomes in terms of patient activation scores and clinical measures at the same time. Different example in a care home. And I think the best bit of feedback from this is that there were two things that went really well. Yeah, we can essentially put patients in a care home to a virtual ward for GPs to be monitoring them. And that's now happening across several counties in the UK. And we're working on a national project currently. By putting patients into a virtual ward in a care home, we can have a local GP practice who are flagged when there's something needs activating and something needs doing. And it's helped mean that GPs don't have to go into care homes. That's got two advantages. One is an efficiency for a GP practice, that they're not having to travel to a care home and go and do a physical ward. The second is that you can reduce the risk of cross-infections by people from different healthcare facilities interacting. The final advantage is that patients perceived they were getting better care. The healthcare workers in those facilities and the care assistants in those facilities felt they had better access to GPs. And the time taken by those general practitioners in supporting that care home was reduced by nearly half. So we had a healthcare system that became more efficient, patients and carers that were feeling like they were better supported, and there certainly has been no worsening of outcomes at the same time. This is the slide that I mentioned earlier, which is the data pre-COVID. So this is looking at care of COPD patients in a normal world. As part of a slightly larger project, and we demonstrated that we could reduce hospital admissions by nearly, just over 2/3, saving a significant amount of money with a 4.8 to 1 return on investment. And this was by monitoring people, it was by supporting them, and by helping them to feel engaged and indeed safe. Final slide from me, because I was allocated a very strict 10 minutes, which I've probably gone over. To enable change, it's about largely supporting people. It's about making it simple for users, both citizens, patients, and staff, and using that healthcare expertise to engage both clinicians and patients in understanding that this isn't about digital. This is about the future of healthcare and how we make digital something that's normal for everyone.
Okay, thank you very much for that, Chris. We do have one question for you, and this is from Leonard Torsu. I don't know whether you can bring the question up yourself, but what he's saying is a unique product needs to be distributed. How do you intend rolling out to developing countries? What barriers do you foresee in the rollout and implementation? How do you intend to overcome them? And are you intending working in partnership and collaborative when rolling out to these countries?
Yeah, nice simple question to start off with. Thank you, Leonard. So the simple answer is we are already partnering with organizations in international territories. We are experts in health generally. We're not experts in different healthcare systems. So we are partnering up with local experts in those territories. If I give an example of a piece of work that's ongoing in India currently, which is certainly a developing country in terms of the healthcare system as they operate. And we're working with a local partner with some government agencies and trying to deploy the software involved in CliniTouch with the minimum amount of hardware requirements to keep the costs as low as possible in those countries. So yeah, we're certainly committed to partnering, working with local experts, and we foresee a positive rollout in those international territories with those local experts.
Thank you very much for that, Chris. And thank you very much for the question, Leonard. I should have mentioned at the beginning that if you have any questions, please do use the Q&A icon to ask your questions rather than chat. You're welcome to use text chat to have a friendly conversation with the panelists or yourselves. But if you have any questions, please use the Q&A box. So now I'm going to move straight on to Leon Eisen. I'm not sure whether Leon will have the same issue with the firewall, but Leon.
Let's check it. Let's try. So I share my screen now. And if it will be some problem, just let me know and we will smoothly move to your part.
We can see it fine, Leon. So over to you. 10 minutes, please.
Okay, thank you very much. I'm happy to be here and share what I think about healthcare in general and healthcare of elderly and very severe sick population. And about myself, I'm inventor of the world's first FDA-cleared pulse oximetry monitor that enables to measure patient continuously, and all sensors are allocated at wrist. So it makes all measurements very comfortable for prolonged use. It could be days, could be 30 days, it could be year. And it enables to collect data in real time, every second, almost all vital signs that we have in the shelves in the hospital. So we succeeded to put these all vital signs on the wrist. I have PhD in physics, and for the last 20 years, I spent on development of medical devices, helping many companies and with breakthrough and totally innovative devices. And finally, I invented my own, based on my own ideas, I invented a totally new device that is today in the market. So in Oxitone, which I founded 10 years ago, our mission to help healthcare companies, remote patient monitoring companies like Chris explained now, and clinicians to help to deliver healthcare to high-risk patients, to patients with very severe chronic and complex conditions. And these patients are dramatically overlooked today because all technology, what was developed so far, was intended for some average patients. And this technology actually deliver only spot check measurements, fragmented measurements. It's a good picture, but a picture taken once a day, once a week, that doesn't deliver a lot of information for physicians to titrate care plan, to titrate the therapeutic decisions specifically for very, very diseased patients and specifically for elderly patients. And most important, that elderly patients and patients with very severe chronic disease, like, for example, CHF grade 3 and 4, COPD grade 3 and 4, they're not manageable at all. You cannot empower these patients actually very well. You should empower clinicians to help these patients. You cannot ask them to manage. They cannot be actively involved into their care management. And this is the main problem. So we have to focus on some passive measurements where their involvement in their healthcare is minimum. And these patients just have 5% of these patients consume 50% of all money, or 20% of these patients consume 80% of all our money dedicated for healthcare. And this is a real crisis that now, but it's a bit solved yet. And when we talk about this paradox, why so sick patients have so low attention from technology guys, from healthcare, because it's very costly. So we developed totally unique technology that enables digital continuous monitoring on these patients. So patients in a high risk level receive our device. This is the world first FDA clearance pulse oximetry monitor. I also have CE mark, and data starts flow to our platform, where physician could unlock patient data in real time and decide immediately if something happened. So we developed a lot of vital signs that our device could measure, and soon we will add blood pressure, cardiac output, and more vital signs. Finally, we're going to close all needs that all these patients need across many diseases. And the main beauty of our technology, because we think that in order to make it comfortable and very accurate, it should be some very unique technology, and we developed such. It's an elastic optical aperture that enables to follow patients' wrist anatomy change, and it enables measure around the ulnar bone and enables very accurate data to generate. At the same time, we offer software product portfolio. So we build all our protocols for sleep apnea, for COPD patients, for patients with COVID-19, and now we focus on post-COVID-19 rehabilitation. And this is what our customers benefit from. And results are very, very good. First of all, patient compliance to wear for 30 days is almost 90%. Patients report very high level of comfort. And actually, for the last half of year, all patients, more than 1,000 patients using our product, didn't report any readmission. And this is amazing, because taking all this data, we apply artificial intelligence algorithms specifically for notifications, and we prevent not some random deterioration of disease. We prevent the full complications. And we are working on more devices, specifically for sleep apnea, that is ring, and specifically for upper arm monitor, that is for kids, and for people who cannot wear devices at wrist. If you have any questions, I'm here to answer.
Thank you very much for that. If you will stop sharing your screen now, Leon, so that we can see you. We do have a question for you, and it's from Charles Obasi, and he's from Nigeria. And he's asked a couple of questions. How can we partner and leverage your healthcare solutions within the African region, considering the prevailing healthcare challenges in the area? And have you considered extending your solution to this region, or do you not have any plans to do that? And finally, talking about the technology, how can your healthcare solution address the challenges in very rural areas of Africa without internet facilities and with high literacy level? What's your view on that?
Okay, about first question. We are working over the whole world. We have our clients in Australia, in Japan. We are not only focused on US and Europe, and also in Latin America and Chile, and we have some distributors in South Africa. So they can apply to us directly, and we can figure out how we can help to build continuous monitoring solution in Nigeria and other places in Africa. We're open to any type of collaboration in Africa. So we're agnostic to any area.
Okay. And the second question about, do you have similar technology for management of diabetes? I know there are non-intrusive devices emerging on the marketplace that measure blood sugar levels.
It doesn't exist. It doesn't exist. and it won't exist for a long time because today technology doesn't allow any totally non-invasive measurements of diabetes. And this is a problem. A lot of companies tried. It was spent more than $2 billion in our work to try to solve this problem, and still we have semi-invasive companies for continuous monitoring like Dexcom, for example, but we don't have any devices and technology for totally non-invasive diabetes monitoring.
And then just finally, just one time for one more question from Cheeky Opera. Have you got plans to develop sensors that measure other parameters beyond heart rate, blood pressure, and temperature?
Yes, this is what I showed quickly. Today we have blood oxygen saturation, pulse rate variability, stress measurements, sleep apnea, skin temperature, and any types of activity specifically designed for rehabilitation of post-COVID patients and patients with COPD. This is very similar technology. And we are adding now respiratory rate by the end of September. It's inside of our devices already, so we will update devices for our customers, and it will be respiratory rate there. And by the end of this year, we're adding blood pressure and some blood pressure related derivatives to measure patients with cardiovascular diseases.
Well, thank you very much for that, Leon. We're now moving back to the panel and to our next speaker. And so I'm going to now invite Joao Bocas to load his presentation and tell a little bit about himself and what technologies he's been researching.
Oh, fantastic. Can you all see my screen now?
Yeah, we can see you.
Brilliant. Well, good morning, everybody. And first of all, David, thank you so much for organizing the workshop. I'm delighted to be here. And also, Chris and Leon, thank you very much for your presentations so far. And a warm welcome to Ron for joining us, this prestigious panel. So I was extremely impressed by the simplicity of Clean Touch view. I came across a lot of different technologies, the simplicity, but also the efficacy. And of course, the wearable device from Leon, you're doing extremely great work. So now going to my presentation, I'm going to try to give a brief overview about what is coming, what is expected, and some of the things that I've done in the wearable space. I've been working in digital healthcare globally for the past 5 years, but also I have a very niche focus on wearables. So going into my presentation, let me share my vision first of all. I really truly believe that the game changer for all of us is the combination of wearables and artificial intelligence in healthcare, of course, and medicine. Because a few years ago, we had some medical devices and wearables, but we didn't have enough data to play with. And this is still very, very new. But I believe the combination of emerging technologies, in this case, artificial intelligence and wearables, will be a really revolutionary thing for medicine and the healthcare of the future. And let me share this statistic with you. There is an expected to be about 75 billion of IoT connected devices by 2025, which is, which is incredible. This is not only healthcare and medical devices, it's all sensors, other industries and everything. But that gives you an idea of where we are heading in terms of using emerging technologies, wearables, sensors and medical devices. Is quite a big number, which also will represent a lot of challenges, present and future, which is expected. Moving on. David, at the very beginning, mentioned the communicable and non-communicable diseases, and also the this case I addressed the main five. the also called lifestyle diseases, the non-communicable diseases, the heart disease and cardiovascular, diabetes, as we mentioned, cancer. Obesity recently was considered by the World Health Organization classified as a disease officially. And also you have hypercholesterolemia, which is hypertension anyway. And all these conditions can be prevented on or reversed in some form. And of course, the wearables and the medical devices have a really crucial part to play. I also would like to share with you this book by one of the leading digital health influencers from US, Eric Topol. He wrote several books about medicine and healthcare and some emerging technologies that he's been working with, and he does a lot of research. I strongly advise all our attendees to follow him. And he wrote this book called The Patient Will See You Now, which I read in the past, and it turns the medicine and the healthcare of the future upside down. It changes the paradigm and gives the power back to the patient. But of course, that is only possible if we have some kind of leading guidance and also a willingness to put towards self-care measurement. And in here again, I would like to link that with the wearables that give us that facility for us to get meaningful insights about our health and about our healthcare. And what is very interesting, and a lot of work I've been doing the past few years, in here I would like to share with you about some wearable trends in 2020. You can see there the fitness trackers, very popular. I mean, in the past, probably the first wearables to come around. The smartwatches, we see recently Apple just launched the Apple Watch 6 with the ECG and other other oxygen saturation and other really good capabilities. Things are advancing very fast. Also ECG monitors through straps, through wearables. Of course, Leon in here has also a very strong wearable device, blood pressure monitors, biosensors, even assault protection, smart rings. Liam had that in his product launch of the future. A very innovative company from Finland that are doing great work. Also now linking this type of data with the COVID, which can be extremely useful in terms of detecting early or even preventing and giving people an indication around COVID symptoms, for example, temperature and other measurements. Wearable speakers, wearables for blinds, wearables in helmets, in bikes, the smart clothing, also a very interesting trend of the future with e-textiles, because all the sensors now are becoming smaller, more powerful, more reliable, and all this type of thing. Actually, the many experts predict, and I also said that in some of the conferences I've been speaking in, I believe that in 5 or 10 years time, the wearables that we see today would be obsolete. You know, things will evolve, and probably the smartwatches that we see today will disappear in some shape or form or become smaller and go somewhere else in our clothing. Smart glasses, smart belts, also the sleep, smart shoes, smart contact lenses. Also, I've seen a very innovative thing around the smart contact lenses from Google, trying to diagnose diabetes reading through actually the tear in the eye. So actually a lot of innovation going on in this space, which is a very interesting space going forward. I hope you get a very clear picture what is out there already, but also where we are heading. And some of these technologies are very recent. Some of them are developing fast. Some of them have a major adoption. Some of them are still very novel. And what I would like to share with you now is some insights from, I've done a research study for nearly 1 year about the 159 pages report on health wearables engagement. And I would like to share with you some of the top barriers, device-related barriers from that report. Interoperability came on the top because the devices and the systems, sometimes they don't communicate with each other and present challenges. battery issues. Some of the devices have 1-2 days battery, which represents a challenge if you do clinical research and need more data and continuous data, even though more wearables now have up to, let's say, a week battery, which is an improvement anyway, but we still, that to be continuous and improved, perhaps a month or two would be ideal in this case. The lack of personalization, because some of the devices give a kind of a generic overview, and the data is not really personalized to a certain condition. And also some people report that they are very bulky and uncomfortable to use, or perhaps that was a thing of the past, because now they're becoming a bit sexier and smaller, if you like. Now I would like to share with you from the same report, 159 pages report, the user-related barriers. The users, and we done interviews face-to-face, we actually interview people using different types of wearables, and one of the things that came on top was the lack of intrinsic motivation. It might be, some people might receive a wearable as a gift or as a present, and they use it for some time, but they never had an interest in the first place, or it was a bit of a novelty. So after a few months of that excitement, the novelty wears off and they don't really engage intrinsically. It's important to at least engage with one particular piece of a data set that you have an interest in continuous monitoring, whether there is your weight, your activity, or even your sleep. I'm using a wearable. I like to measure my sleep. I'm not interested in my steps anymore, but I like to keep an eye on my sleep. Sometimes I do the 6, 7, 8 hours. Sometimes I do a bit less, and I try to really have that continuity and that sustainability in place, if you like. Some people report the loss of a device, which is very common, because you might leave it somewhere, or you stop using and you break the pattern, of course, and then there is no data and there is no benefit. And the human errors, forgetfulness, forget to charge, forget to use, forget to kind of connect with it, forget that you have it. So I always think about the gym stuff, like the continuous fitness. If you don't do the work, you don't get the benefits. Using devices is kind of the same thing in principle. And also, to finish off, some privacy and security issues. People are still cautious about that, about the employers, about sharing data, about large organizations such as healthcare or even pharmaceutical companies taking advantage for commercial purposes. And also the hacking now, which is very, very common. You see big companies now being hacked all the time, healthcare data leaks, even big companies in other sectors. British Airways, for example, they had a major data leak a few years ago, and people are concerned about where their data is going to end up and their personal information. So there are a couple of things there to address. I hope that was insightful, and that's everything from me. Feel free to connect with me on social media. I'm very active, and if you need to know any more insights about my report or anything else, feel free to reach out. Thank you so much.
Okay, thank you, Joe. If you could stop sharing your screen now so we can see you. So we have any questions from someone? We have one from Leonard, and this is a question to you, Joe. I'm a CEO of an NGO and pharmaceutical chain in Africa, interested in partnership, healthcare products. Do you have wearables in the management of diabetes, high blood pressure, cholesterol, etc.? What are the potential challenges of implementation of wearables in Africa? And which particular wearable do you think might be relevant for African countries?
Interesting. Well, to address that, there are many wearables for different conditions. Africa and other territories certainly present challenges around there is no reimbursement state. I mean, there is no reimbursement for wearables, even for healthcare as a whole. Is very difficult. Only probably US and other. The UK is very slowly moving in that direction. We're not quite there yet, but also we do use our wearables. Always poses the question, which is a global question around healthcare, not just wearables, is who pays for it. So that adds adding challenge in terms of the usage, the adoption. But I'm happy, Leonard, to share some ideas with you and even put you through some wearables. For example, Leon has a very innovative wearable there. But there are many companies doing great things, but Africa, it's like the other territories. They have a challenge ahead in terms of bringing the innovation in.
Thank you very much for that, Joao. Now we move on to our final, last but not least, presenter, Ron O'Donnell. So Ron, I'm going to put you center stage and invite you to share your presentation.
Thank you very much. One moment here. So I'm Ron O'Donnell, a clinical psychologist and clinical professor in Arizona State University. And COVID-19 is clearly the greatest health crisis of our lifetimes. And the suffering is immense: loss of life, morbidity, loss of employment, income. And on the other side of the coin, we know a famous quote from Albert Einstein: in the midst of every crisis lies great opportunity. So I want to focus today on not so much any specific health product. I think my colleagues have done a great job of illustrating the importance of health technology products. I'm going to focus on the healthcare system and how we can try to use this crisis of COVID-19 as an opportunity to promote digital health, especially for the prevention of medical and behavioral problems. The degree program I work in is called the Doctor of Behavioral Health, and we're an interdisciplinary degree. We enroll master's level clinicians, both behavioral, social workers, counselors, but also medical, nurses, occupational therapists. We also enroll healthcare managers, masters of public health, masters of health administration. And our goal is to create a new workforce of behavioral health experts, both clinicians and managers, to work with the family doctor in primary care or general practice, doing what we call integrated behavioral health, bringing together both medical conditions, chronic conditions, underlying lifestyle behaviors, nutrition, physical activity, and of course behavioral conditions like depression, anxiety, and trauma that we know are highly comorbid. And in fact, if you add depression to diabetes, the costs are maybe 2 to 3 times higher than a patient with diabetes only. The adherence, the ability to self-manage the condition is much lower. So we have to address behavioral issues, both lifestyle and behavioral problems and conditions, diagnoses, in order to address the needs of our patient population. And digital health technologies are an ideal way to do that. Now, in many respects, I'm an outlier in the United States for the population. I exercise at high intensity, probably 6 out of 7 days a week. I routinely use health apps, both my Apple Watch for recording my activity level. I like to, do long-term swimming in open water, looking at my strokes, my rate, biking, running, and I use apps to inform and guide my own health behavior. So I'm an outlier. Most Americans don't do this, but I'm one, and I hope to see more Americans doing this in the future. On the other hand, I'm not an outlier in other respects, in that I like to eat unhealthy food at times. I enjoy a pint of beer at a time with my friends to watch sports or with my wife. So these are all behaviors that do have adverse consequences. I'm not a perfect person in terms of my nutrition and diet. Also, I'm, like many Americans, aging. And as I age, I'm facing problems like increased blood pressure. I've had sleep apnea for many years. So I've been using health technology in these respects, with my Bluetooth-enabled blood pressure home device, my CPAP device for sleep apnea, and my Bluetooth-enabled weight scale, along with a team of my professionals here. That's my primary care physician to the left, my endocrinologist, my oncologist, I'm a cancer survivor, and my pulmonologist for my sleep apnea. So I have a team that's all digitally connected. When I visit one of them, they're all in the same health system. My records are immediately available to all of them to see. So there's amazing efficiencies, and my connected health goes from my devices at home to my physicians who are caring for me in their offices when I see them or when I'm working with them remotely. Now, COVID-19 has shined a spotlight on many problems in our healthcare system and the need for integrated behavioral health. We know that on the behavioral side, both patients who have been infected with COVID-19, the population at large, we're seeing dramatic increases in depression, anxiety, post-traumatic stress disorder. People are now drinking alcohol more at home, using substances at home, a great problem with loneliness, lack of social support. So we're seeing a huge impact of COVID-19 in our population's mental health and substance abuse. Social media has been a great boon, but also has a downside. People are spending too much time on their screens, spending too much time getting involved into fringe groups that often lead them to unhealthy and misleading health behaviors. On the medical side, of course, we know that if you have a chronic condition, diabetes, hypertension, if you're obese, if you're smoking, and you are infected with COVID-19, your odds of having a poor outcome are much higher, whether it's morbidity or mortality. Medical chronic conditions are actually adverse risk factors for COVID-19. So our challenge is to use digital health technologies to help patients improve their health in these areas, medical and behavioral. So if they are infected with the COVID-19 now or in the seasonal flu in the future, their odds of having a good recovery are much greater. Now, the health system, of course, we know that COVID-19 has also pulled back the covers on many existing problems that weren't really addressed in the past. We've had, certainly for clinicians, we're closing businesses, we're closing down hospital clinics because we can't see patients in person except for acute care, leading to loss of revenue and threatening of closing primary care throughout the United States. We're seeing health disparities. If you're a person of low income or ethnic minority, you're already having predisposing factors that make you at greater risk for poor outcomes for COVID-19. Broken supply chains, trying to get the right devices, even simple mass distributed to our population, has been a huge problem. And this points the need for our health system to look at value in healthcare. How do we reduce unnecessary services like in-person visits we don't really need to have happening? How do we reduce reliance on too many lab tests being done that aren't really required? Administrative burden of in-person waiting and shuffling from room to room. And the answer, of course, is digital health, and to apply digital health to prevention of healthcare problems via public health, pandemic preparation, and trying to address health disparities and inequalities. A great example is the annual wellness visit, right? We go to our physician or our family practitioner, they do a routine checklist of problems, many of which really are not pertinent to us. We're shuffling from room to room, having these things done, which could all be done largely at home remotely. So our future state should be one that's looking at prevention, with online digital health being a key driver for population health. Patient registries identifying at-risk patients, both early in the stage of disease progression and, of course, those who already have chronic disease. And a key idea, one recent article, is an annual prevention toolkit to have the patient receive at home digital health tools to help them identify and understand how to better manage their health conditions. A great example is a health risk assessment that can be done online now that includes questions that are both covering nutrition, physical activity, lifestyle problems, as well as behavioral problems like depression, anxiety, stress. These are available and widely used already on smartphone apps. Our own work has done this, these kind of questionnaires throughout China and Southeast Asia, showing how prominent these problems are and each digital health solutions to solve them. Earlier, we mentioned the Internet of Things and AI. We need to have all these tools marshaled to help create a smart patient. At their fingertips, all the digital tools they need to understand what their risk is. Habit change is hard, right? It's very difficult to change our diet and physical activity. We know from research that techniques that make behavior change easier, more available, that make behavior change techniques tied to existing health behaviors, and that send alerts to the patient about when they are engaging unhealthy behaviors and offering a pathway to more healthy alternatives. These are all the things digital technologies are going to do even more effectively as we add AI in the future. So we hope to see the new prescription pad look like this in the future. Rather than having your medication list, let's have your list of apps you should use for nutrition, fitness, other health problems are specific. Let's have activity monitors, blood glucose monitors, hypertension monitors, wireless scales being all made available to the patient at home, and create a digital prevention toolkit the patient can manage from their own home with physician visits remotely done, not in person, to help them manage their health. This is a nice summary slide of what we have for the new model of healthcare with the primary care physician or family doctor and patient working together, and health technology providing the tools to provide a feedback loop so patients can monitor in real time their health status, get feedback on what problems they're experiencing and get alternative behaviors they can engage in, whether it's medication or whether it's nutrition, physical activity, depression management. And we hope to see connected health being done virtually, with all these steps being done from assessment to shared decision-making to patient self-management, learning to manage their own conditions. I use my own smartphone apps for mindfulness meditation, for managing stress on a regular basis, emotional problems. These are all tools at our fingertips we should try to integrate completely. So in summary, COVID-19 is a horrible pandemic, but also an opportunity for us to use digital health for prevention. Integrated healthcare, bringing together medical, behavioral, and lifestyle conditions, is also critical for addressing our healthcare problems we're facing now. And virtual prevention, the time is now for this to happen. We've had this happen by force because of COVID-19, but we're seeing increasingly the healthcare payers in America recognize the importance of doing digital health remotely as a permanent part of our healthcare system. That covers my presentation. Thank you very much.
Okay, thank you very much, Ron. If you could stop sharing your presentation, we can see you in person. And let's see if we've got a question for you. I don't think there's a question specifically for you, Ron. They're just questions that we've asked before. Now I think what we'll try and do is move on to our discussion session. So I'll bring you all in again. And I have a series of questions that I want to ask the panelists, and also to give our participants an opportunity to ask additional questions. Before I do that, there's just one or two screens that I want to share with you when I can find them. So before I move on to the discussion and the debate, I just want to share a few screens really to set the kind of scene for some of the questions that I want our panel to discuss. And these are all as much up-to-date information I could get from the internet. But when we're looking at preventative healthcare and some of the digital technologies, these are some of the bits of information that we could take into account when we're looking to establish where the priorities are. So this is a graph based in 2020, and it's actually a rolling, updated presentation that looks at different causes of death. So if we're looking to invest in preventative healthcare, one of the ways of looking at that is to look at what the main causes of premature death are at the moment. And we can see that cancer and communicable diseases, non-communicable diseases, are actually at the top of the list. And coronavirus is well over halfway down, and just as a fraction of the causes of death of some of the other problems shown there. So going back to our healthcare stakeholders, I want to now go to ask the series of questions again to the panelists. And I'm going to begin by asking what the priority should be when we're looking at investing in digital technologies for personal health management and preventative healthcare. Where should our priorities be? I'm going to ask Joao this as a person who's done a lot of research into these kinds of technologies. Where should we be spending our money in preventative healthcare? Should it be on communicable diseases and prevention of NCDs, or should it be on reducing the impact and cost of communicable diseases and non-communicable diseases? What's your opinion on this, Joao?
Yeah, well, good question. I think this is a global topic in terms of what I've been noticing, and I work in health for probably the last 20 years. I mean, I was in corporate wellness, and one of the things that always presents a gap is in education. Okay, people are not well educated in general around health, and also there is misconception that healthcare is complex, and it is complex in terms of process and governments and systems. So I would say one of the biggest challenges going forward is to kind of, for example, if we're talking about devices, how can we make the devices cheaper, increase the rate of adoption for people to use them, and of course, who's going to pay for it? Because there is not a system, and I'll give you an example where I would like to see this evolving. Recently, Apple done a partnership with Lumi Health in Singapore to incentivize health behaviors. Okay, people get points and they get return on being active and being investing in preventative health. In UK, Vitality Health, a large insurer, has been doing that for quite some time. But I'm actually surprised that this is not a pattern that everybody is doing on two things. One, educating people, and one, incentivizing preventative health. So we always find ourselves in this position of treating, of reactive health, and it's very, very difficult to come out of this trend, because that's the norm in healthcare. And I would like to see cost going down and also incentivizing people to take action, really. But it's a very difficult challenge.
Yes, it's quite a complex question, but it leads me on to the next point, and I'm going to bring in Chris Barker to answer this question, and that is the question of who is it who should pay for these solutions. Joao has just brought out the point that, of course, everybody has a stake in this, and everybody could benefit from preventative healthcare. In your experience, Chris, do you have problems in getting the right person to pay for your solution? Do you have any challenges in that area? Who do you think should pay for the solutions that Spirit Healthcare are involved in?
Thanks, David. Another simple question. So from a UK perspective, we have a National Health Service. That largely, as we've mentioned earlier, is focused on reactive healthcare, whilst it's trying to be more progressive and more proactive. There are also local authorities and government funding for social care, which means that there are different funding pots which the government are increasingly trying to integrate in the UK. To answer the question, who do I think should be paying for healthcare? I think the answer probably is that the weight of expectation falls upon governments to do so in the UK. That might fall to insurance companies in different parts of the world. Ultimately, from my perspective, what I would like to see is actually a combination of all of the different stakeholders contributing in their own way to this market. And that might be, Joao mentioned about people being less well educated than we might like in terms of healthcare. I also think there's an engagement problem in terms of people getting engaged in supporting and managing their own healthcare and well-being. So if people are prepared to get engaged and commit their time to this type of solution, that actually can save healthcare systems money in the future, and indeed insurance companies. So I think there is an opportunity for a piece of work to look at how we can all contribute to this market with digital, enabling healthcare to be more scalable, whilst governments might put in some money, insurers might put in some money, and citizens and people and carers will contribute some of their time to make it effective. And by collaborating together, I think we can make this more of a reality.
Can I just float a simple idea with you, Chris, and that is looking at the responsibility for payment and the cost benefit of people paying for things. If you look at care homes and independent living centres, my mother's been through this process of living in an independent living centre and then going into a care home. It seems to me that there is some competitive advantage to be gained by care homes being able to offer this as a solution to their residents, as a differentiator between themselves. So looking at, in later life, McCarthy and Stone, for example, what if they had a unit that delivers this kind of preventative healthcare as part of their offering to their residents? Is there not some sort of merit in these organisations investing and forming partnerships with people like Spirit?
Yeah, absolutely. Our challenge, of course, as always in the UK, is around equality as well. So, yeah, the likes of the company you mentioned with the more private residential facilities, absolutely. There is the potential for partnerships where they want to promote their services to people that can afford to pay. So I think, yes, there is absolutely a way forward there. The challenge, however, for me is also how do we support people that are in council-run facilities or council-funded facilities where perhaps the propensity to pay is not quite so significant, and they don't have the same desire for competitive advantage that you might have in your types of residential living accommodation. So I don't think there's one answer, David, I guess is where I'm at. I think there are different answers for different parts of the market, and what we need is a tidal wave of people wanting to make it happen so that we can drive that not just across the UK but across the globe.
Yeah, I think that's a good answer. There was another question here that kind of relates to that, and this is from Gareth Fritt. It's about the health and the health and welfare of the workforce. It's very important, particularly in the COVID environment. What he's asking is there a role for wearable devices in maintaining the health of the healthcare workforce, not just healthcare workforce, but any kind of workforce. I'm going to bring in Leon and ask him to comment on that question. Leon.
I think we have to categorize things, and we have to separate some wellness stuff from medical stuff, because we have two elements of prediction or prevention. First of all, we're talking about prevention of disease in general. So if we are talking about healthy people that who are working well, and some disease just because of genetic stuff or something like this just start to maybe will come in future. So these people should be monitored by wellness devices, should have some behavioral health programs, and in this case, they should pay family, or most of the cases, employer pay for their people. If we're talking about people who have already chronic diseases, and specifically severe chronic diseases, and this is where we have a real problem, because this problem we have to solve now. Wellness problem, this problem it's just we have to solve in future. This problem we have to solve now, because they today just have a huge burden of our financial system, and this is the most important. So in this case, I think government should pay, because usually people with severe chronic disease, they don't have employers anymore. Elderly people with complex diseases, they don't have employers anymore. So if we're talking about nursing homes, it should be family or some foundations. And if we're talking about people with these diseases in general, it should be some charities and government. The most important, like in the United States, Medicare, Medicaid, they take care of these patients.
Okay, thank you very much for that answer. That actually articulates very well the kind of dividing line between chronic conditions and existing conditions, and the role of preventative healthcare, and the whole issue of prevention, whether it's preventing a communicable disease or a non-communicable disease, where wearable devices and non-medical grade devices are likely to be more attractive to employers and insurers, as you're already seeing the case with Vitality Life, as Joao mentioned, in the UK, and I think we'll see increasingly that. So, Ron, moving on to looking at the target users and the challenges and opportunities in this sector, who do you think we should be kind of focusing our effort on as users? You're as a behavioral health specialist and a clinical psychologist. It seems to me that people's motivation, people's desire and involvement in this process is absolutely critical. How do we get people to become an outlier like you, to take more interest in their own healthcare? Because as Leon indicated just a minute ago, you may be talking about a problem in the future. This may be one of the reasons why people don't engage in their own, if they're healthy, they don't engage in their own wellness because they think diabetes and cancer and cardiovascular is not going to happen. It's going to happen to somebody else. So how do we do this with wearable devices?
I think there are two levels. First, the level of healthcare providers. We have a great example in behavioral health with the move to telehealth. We have a grand experiment. Suddenly, all the psychologists, social workers are seeing patients remotely for their sessions. What's happened with that approach? Initially, some shocked the system. People used to in-person had to adjust, but now they're doing telehealth routinely. You're seeing no-show rates drop out as patients don't worry about going to the office. You're seeing better engagement. That's the good news. The bad news is you're not seeing healthcare providers educated about how important it is to use smartphone apps, for example, for depression, for anxiety. We know that from research, those devices are as effective as in-person psychotherapy for most patients, and they save great clinician time. So the providers pushing digital health is one key thing. And for the patient, the good news there, patients already love using their apps for healthcare, for education, for research. They need to be given the opportunity to use these apps and wearables and devices remotely to incorporate that into their healthcare system. I think the earlier comment about the government and healthcare payers being responsible, they must integrate these tools seamlessly so patients can stay at home, take care of their blood pressure, their blood glucose, their stress, their depression, all remotely, going to the doctor for acute care when needed for in-person, otherwise doing things virtually. So it requires both ends, the clinicians, the providers, as well as the patients giving more access. They already love using their apps right now.
Okay, thanks for that, Ron. We're now moving towards the closing time of our webinar. So I'm going to ask each of our panelists to give me some closing thoughts on the future of digital personal health management and preventative healthcare. And we maybe have time for a final question right at the very end. So I'm going to go in reverse order. So I'll start with you, Ron, as you were the last person to present. What are your final thoughts about the future of preventative healthcare?
Well, quick example, the future is bright because patient engagement. Engaging patients is really critical and our biggest challenge. I worked years ago for a health plan overseeing teams of health coaches doing telephonic coaching, and the coaches who could engage the patients talking about their family, the weather, how they're doing, those kind of things to engage patients were more effective than those just trying to use the rote script to help do health promotion. And now we have AI-enabled smart bots that can actually have a conversation with you. It seems like you're talking to a real person that's engaging, talking about your personal interests, your hobbies, while engaging you in health. So I think you're going to see a greater proliferation of AI for both devices and apps to better engage patients and leading to better outcomes as long as we support these tools in the healthcare system.
Okay, thanks for that, Ron. Joao, what's your final points you want to make about the future of these technologies?
Yeah, sure. Well, putting things into context, and I think in one of the slides from Ron, he mentioned the coronavirus situation, which is like apart from a lot of people dying and is a true global pandemic, is probably a blessing in disguise for the industry, because of course we have this virtual meeting now, but pushing the agendas forward and really forcing the things that we've been talking about for the last 4 or 5 years. And I attend a lot of global conferences around pushing the innovation forward and adoption and digital healthcare as a whole, including wearable devices. Where I see this going now is actually, it might take a little time, but that will be the norm. The usage of wearable devices, the telemedicine, these digital technologies, the Clinic-Touch View platform to be used worldwide. This has to be the norm. And we've been talking about that for quite some time, but I think now with the COVID situation, it is the norm because we are forced to. The patients cannot be seen. They can't go to healthcare facilities. The care homes need to be protected. So there is an overall picture now. This is the right time to force the agendas forward, forced in a nice way, because we have to do it as professionals and industry leaders. So yeah.
Thank you very much for that, Joao. Leon, moving to you, where do you see the future lies? Clearly, you're very much involved in the prevention of the impact of chronic diseases in particular. Do you see a challenge from wearable devices like the Apple iWatch? Do you see those devices pitching more and more for becoming clinical grade devices, and so challenging the technologies that you developed at Oxitone?
Yeah, I don't think it will happen, because to develop a medical device and wellness devices, these are totally different markets, totally different approach, and it's a different stuff. And if people think that it's possible some fusion between wellness and medical devices, I'm not sure about this. I think it's better, it will be fusion maybe within implantable devices. So I think the future is implantable devices, as Joao said correctly, and wearable devices is just some in the middle, some temporary solution today. And it will be also different type of devices. This is first. And second, I think about future that our body and our brain is the most important pharma, the best pharma in our world, right? So correctly guiding this pharma and applying behavior change tools, that's important. And this is what will make difference. So I think its future is developing all these tools, developing advocacy for these tools to deliver these to people. And also using some devices just to generate data. It's not something that is good itself. It's just to generate data. It could be in different types, and this just helps patients or people to apply their brain and their body capabilities to measure, because if we don't measure, we cannot improve. That's all.
Thank you very much for that, Leon. Finally, Chris, your view on the future. I guess for Spirit, COVID-19 has come as something as a blessing to you. Do you see this as a kind of platform and launch pad for Spirit Healthcare to spread with its solutions all over the world?
So I'm not sure I'm going to be describing a pandemic as a blessing. I think Joao used the words that I'd probably pick earlier on, which are, yeah, certainly there is a silver line to come out of the horrible situation we find ourselves in, which is that the use of digital technologies, and that might be something as simple as telephone triage. It might be, the sort of monitoring that Leon's looking at with Oxitone in terms of continuous improvement, and yeah, CliniTouch is somewhere in the middle of those two ends. From a company perspective, absolutely, there has been an escalation in the use of CliniTouch across the NHS and in the UK and also internationally. So yes, that's been a good thing. What do I think the future looks like? Well, so I think it has to be about how we, one, develop the technology, both in terms of the software like we do, but also the wearables that other people have elegantly spoken about. It's also about how we bring both governments and citizens and people on that journey so that it becomes all-inclusive and it becomes something which becomes normal and not something that's done during COVID and then we regress backwards again. So for me, how we keep the momentum that's been built up to move forward on that digital journey and making digital healthcare normal. And for me, as yet, we haven't quite got the answer to it, but I'm working avidly at both myself personally and as a business to do that in the UK and beyond.
Thank you very much for that, Chris. And also thank you very much to our participants for joining us today and for your questions. I'm now going to close this session and bring up a closing screen just to remind you that we are running these webinars and workshops on a regular basis. Our next expert panel discussion will be next week. It'll be next Tuesday afternoon, and it will be looking at the role and future of virtual reality and immersive technologies in medicine and digital therapies. And once again, I've been very blessed to have a super panel to present some of their solutions, as we've done today, and also answer questions and discuss where the future lies with these technologies.